Oregon just voted to outlaw private equity in healthcare. This is a really big story. I got to tell you guys, I am seeing more and more get accomplished through the states, whether it's ballot measures, whether it's the Supreme Court pushing actions back to the states and saying, you deal with it. There were a number of states that passed a woman's right to choose, even some of them being red states. So I think this is a heads up for everybody. I think, again, a lot of our fight is going to be more so on the local level. And I really do think that we're going to see more actions through the states. But what is the problem with private equity in healthcare? Let me show you this video first, and then we'll get into what Oregon has been able to accomplish.
He's dedicated his life to service as an Army surgeon and emergency room doctor.
I took an oath to protect patients to the best I could.
After he left the Army, Bravant took a job as medical director of the ER at Overland Park Regional Medical Center in Kansas. It was 2012, and soon after, he began raising concerns.
I felt that they were prioritizing metrics over quality of care.
He says by 2014, staff was stretched thin when an expansion project doubled the hospital's capacity, and the private equity-backed firm in charge of handling staff refused to add more doctors. It's a growing complaint across the country. Doctors and nurses concerned profits are put ahead of patients as more private equity firms take over healthcare groups. Today, it's estimated over 40% of the nation's emergency departments are overseen by for-profit staffing companies, all of them owned by private equity. These Wall Street firms look for a return on their investments on a shorter timeline, and academic researchers tell us the largest profits are often in the ER. How does that?
I have been sounding the alarm about private equity. I actually had a speech about this that I gave at the Community Church of Boston last year. Listen, people have to understand how dangerous private equity has become in just like our everyday lives. Like, for example, they've been buying up housing, right? Private equity has dipped its toe into the real estate market, where they're buying, apartment complexes. And now they have a hold on that. People can't buy single family homes, not just because they can't afford it, but because private equity, they dip their toe over there and they're like, we are going to buy those homes and we're going to jack up the price so that everyday people can't afford to buy a home. Well, private equity also exists in healthcare. And then you see what is happening here, how healthcare basically has become a for-profit system. And it's not necessarily as much focused on how are we going to help people and heal people. The focus is how much money are we going to make? This should have never happened, but here we are.
Affect patient safety.
What I was concerned with is having enough adequate time to do the job properly. As our volumes grew and the popularity of our ER grew and our responsibilities grew, it became clear to us that my physicians were being asked to be in 3 places at once.
Bravant says that wasn't the only problem. He says doctors and nurses were expected to improve metrics by admitting more patients without adequate exam time or bed space.
This also happens in education. More and more teachers are being forced to have larger classroom size. So they're being forced to have more students in the classroom, but no extra resources, no extra help. And now you see this is happening in healthcare as well. Some of you watching, you may have worked in the healthcare system. Maybe you're a nurse. Maybe your mom was a nurse. Maybe your friend is a nurse. And talk to some of your friends and your family members that are nurses. Talk to them about them and ask them, like, how has their patient to nurse ratio been recently? Are they giving more patients with less time? Again, it's all for profit.
You want your doctor to be the advocate for you. And if they have this business interest over their shoulder, they may not be able to make the best decision for you.
Dr. Robert McNamara is the chair of emergency medicine at Temple University. He's also the chief medical officer of a group representing about 8,000 emergency doctors nationwide. Do you think private equity firms should be in the business of medicine?
Certainly not in emergency medicine. You're having people that are seeking to make a significant profit off of healthcare.
There are laws on the books to prevent the corporate practice of medicine. Are they not being enforced?
No, they're not being enforced.
McNamara says state attorneys general rarely prosecute these types of cases, and doctors often don't speak up for fear of losing their jobs.
So even the doctors are held by the knife. You see that? Now, notice what he even did. I think he's afraid too. Notice how he said, well, not in the emergency situation. private equity shouldn't be involved in healthcare, period. Period. But I think he's also afraid of losing his job. See how that works? The doctors are also beholden to the pharmaceutical companies.
And these are billion-dollar companies that you're fighting. You're fighting Wall Street.
Ray Bravant was ultimately fired in 2017 after raising his concerns. By then, the company that controlled his unit staffing was no longer owned by private equity, but by a for-profit publicly traded company. In 2017, he filed a wrongful termination lawsuit against the staffing company's subsidiaries. His former hospital was not named in the suit, and the private equity firm did not respond to NBC News. A year later, the company was back in the hands of another private equity firm. Bravant was eventually awarded $26 million.
I had to be the guy that stepped up and said, this is wrong. There's a principle behind why I'm doing this.
In a statement.
And this is the right response, right? Sue. Sue. Someone said it in the chat just a minute ago. Someone said, sue them. Sue. I told you, you got to start suing people. Sue these people. Because the only thing they understand, their only language they understand is money. That's it. So sue these people. He did the right thing. Won $26 million, right? When in reality, all he wanted to do was he wanted that system to change, and he probably wanted to still keep his job. They ended up paying him more than what he wasn't going to make $26 million in his profession. So think about that. So they ended up paying out more. Now, I show you that because we got to do a little celebration for Oregon. We got to do it, okay? And I may have to drop the beat because it's not every day that something like this happens. Shout out to Oregon, folks. State passes first in nation bill to block corporate control of radiology practices. This is breaking news, ladies and gentlemen. That is Oregon's Capitol building there. I've never been to Oregon State. If you've been there, let me know what it's like. Oregon recently passed what advocates believe is the first bill in the nation aimed at blocking corporate ownership of medical practices in radiology and other specialties. Democratic Governor Tina Kotek signed the measure into law on Monday, June 9th, over the objection of opponents such as Amazon and the Oregon Ambulatory Surgery Center Association. In 1947, the state established the corporate practice of medicine doctrine to ensure medical decisions are made by licensed professionals. This covered everything from how much money is spent on care to staffing levels, time spent with patients, and to whom physicians can sell their practice. However, advocates contend private equity firms and other corporations have exploited loopholes by employing or contracting with physicians who are listed as owners to comply with the doctrine. Instead, these docs often lack true control over the practice. Senate Bill 951 closes this loophole, restoring the intent of the corporate practice of medicine doctrine and protecting the integrity of patient care in Oregon. Let's drop the beat for Oregon, fam. We gotta drop the damn beat. Dance with me. Dance with me. Drop the beat. In the street. Woo! All right, ladies and gentlemen. I didn't think we would drop the beat tonight, but then I saw the story and I'm like, no, we have a good news story. We got a good news story. We got to drop it because this is big, you guys. This is big. So they go on to say, we're not reinventing the wheel here. We're defending a principle that once made Oregon a leader in protecting patients. This is coming from Republican Representative Cyrus Javati. Back in 1947, we drew a clear line between who could own a clinic and who could practice medicine because we understood that healthcare isn't just a business, it's personal. I would say the problem of healthcare becoming a business is part of how, we got here. Senate Bill 951 updates that line for a world where private equity firms and management companies have figured out how to blur it. We owe it to patients and to doctors who still believe in putting care first to draw that line again. In the making for this legislation, state lawmakers cited a 2023 perspective piece. It contended that recent multi-billion-dollar primary care investments by Amazon and CVS could threaten equitable access, raise costs, and reduce physicians' clinical autonomy. The bill limits control these companies, can have in clinic operations and bans non-compete agreements used to prohibit radiologists and other physicians from taking jobs at different practices. So this is huge, guys. This is huge. And you know why I bring this up again when we talk about the states? Because here's the awful truth. I am seeing it more and more, guys, where I think most of the wins are going to be on the state level. Rather, it has been passing $15 minimum wage, which we've passed here in my state, Massachusetts, and we've also passed in many other states as well across the country, even in some red states. Yes. When you look at some of those progressive policies that a lot of us support, these seem to pass a little bit easier in the states. We are not able to pass them on the national level, at least not now, right? But they're passing in the states. And I just bring up this again about ballot measures, right? So Oregon is one of those states. They have direct, constitutional amendment or state statute. It's one of those states, again, where we can use our power on the ballot through the state level. And just to show you one of the measures that they had, now, not everything passed, right? So one thing that was ratified was impeachment of elected state executives amendment. But one of the ones that I wanted to show you, which apparently did not pass in a lot of the states, was ranked choice voting. And I'm trying to explain to people, I think the reason why it does not pass is because I think people just have a difficult time understanding that question. But again, as much as we have been asking for ranked choice voting, you can see it was defeated there. It was a no by 52.5%. But as much as we've been asking about it on the national level, it has been able to pass on the local level, whether it was through a BI or an amendment. And I really think this is where we are going to see the wins. This is why I keep trying to bring up some of these local conversations, because I want you guys to know, I know things look bleak on the national level, but in the states, things are passing. And if we blink, we might miss it. So let's make sure we're paying attention to those things as well. Hey guys, this was a Sabby clip. If you like what you saw, hit that like button and subscribe.